Today, we need to talk about a public health catastrophe that's unfolding in the Indian state of Meghalaya. What we're seeing are recent reports that show how a completely treatable condition is spiraling into a crisis of, well, epic proportions. We're going to break down what's happening and why it points to a catastrophic failure of the system. So, let's get right into it.
And really, this one question just cuts right to the heart of it all. It's the question that hangs over everything we're about to look at. Are the very systems designed to save people's lives actually condemning them instead?
Okay, so this is the number that really set everything off. Recent government figures have confirmed it. The number of people living with HIV in Meghalaya has now officially crossed 10,000. Now that is a huge number for the state. And we have to remember, behind that number are thousands of individual lives and stories.
So the big question is, how did we even get here? I mean, this is a treatable condition. How did it reach a crisis point? Well, it definitely didn't happen overnight. So let's walk through the timeline of how this whole situation escalated.
You know, the crazy thing is, the warning signs were flashing bright red. As early as July of this year, there were reports flagging the cases had actually doubled in the East Khasi Hills. But the situation really just exploded into public view in late November, literally days before World AIDS Day. A day that's supposed to be about solidarity and progress became the symbol of a massive, massive public health failure.
And this is where you see this just massive disconnect. On one hand, you've got the government talking about their Vision 2030 for an HIV-free Meghalaya. It sounds great. But on the other hand, the reality on the ground, it's a totally different story. It's a story of a state that isn't just failing to win this war, but is actively losing it. The gap between the ambition and the action is just staggering.
You know, it's so easy to get lost in the statistics and the policy talk. But we have to remember, behind every single one of these numbers, there are real people. And tragically, some of the most vulnerable people caught up in all of this are children. 500. Just let that sink in. That's the number of children in Meghalaya who are living with HIV right now. That's not just a number. It's an absolute indictment of the system, because almost every single one of those cases should have been prevented.
And see, this is the really heartbreaking part. We have proven medical steps, a whole process called PMTCT, specifically designed to stop a mother from passing HIV to her baby. It's standard procedure. It works. So the fact that 500 children are infected, it just screams that this basic fundamental safety net has completely, utterly collapsed.
And that breakdown brings us to the real core of this whole bureaucratic mess. You know, it's one thing to identify people with a problem, but it's a completely different thing to actually help them. And in Meghalaya, the gap between getting diagnosed and getting life-saving treatment, it's called antiretroviral therapy, or ART, that gap is terrifyingly wide.
Okay, let's just zoom in on one area, the East Khasi Hills, to see what this looks like. You've got over 3,400 people who have been diagnosed with HIV. But look at this. Fewer than half of them, just over 1,500, are actually getting the medicine they need to live. So, where are the other 1,800 people? What happened to them?
Seriously, where did they go? It's the critical question. Are they facing drug shortages and they just can't get their prescriptions filled? Did the system just lose them? Or maybe the social stigma was just too much and they were afraid to seek help? Or, and this is the most terrible thought, have they already died? No matter what the answer is, it all points to a system that is completely and utterly broken.
Look, when a system breaks down this badly, you got to start asking, is this really about not having enough money, or is it about not having the right priorities? And trust me, when you start following the money here, the picture it paints is, well, it's deeply disturbing.
Okay, check out these numbers, because they tell you everything you need to know. To provide those life-saving ART drugs for all 10,000 plus patients, it would cost around 6 crore rupees a year. Now just hold that number in your head and compare it to what the state is spending on other things. 130 crore on scholarships, 28 crore for a new government building in a completely different city. The cost to keep thousands of its own citizens alive is just a tiny, tiny fraction of these other projects.
And this chart right here, this just drives the point home in the most shocking way possible. That 6 crore, it's not even a rounding error in the state budget. It's 0.02%. 99.98% of the budget goes to other things. This has nothing to do with a lack of funds. This is a crisis of priority, plain and simple. The money is there. What seems to be missing is the will to actually save these lives. So when you put all of this together, the numbers, the failures, the money, it leaves us with some really urgent and frankly unavoidable questions for the people in charge. Let's start with the absolute basics. Where are the drugs right now? Is there enough medicine in the state for the people who need it?
Or are they being sent home empty-handed?
And next, why is something so preventable still happening? How, in this day and age, are hundreds of babies being born with HIV when we've known how to stop this for decades? Why are these basic, fundamental health procedures failing so miserably?
And that brings us to the final and most important question of all, the one that hangs over this entire catastrophe. With a condition that is so manageable, with medicine that costs so little, why are thousands of people who have been diagnosed being left untreated? Is this actually healthcare, or is it simply death by bureaucracy? That is the question Meghalaya has to answer.